Okay. Anyway, I'd like to welcome our very select audience. And what I'd wanted to have a little chat about today is the link really between disarmament, prevention of war, climate crisis, and health. Now, I think that looking around the table, most have had will probably intuitively understand that, but I just thought it might be useful to just maybe dwell on it a little bit. Often before a talk, we talk about conflict of interest, which generally speaks, do I have some financial interest in some information I'm sharing? I prefer to talk about my biases because we all have them. And it's important that when we do give a talk, that maybe drawing a little bit of attention to our biases can help just orient ourselves to both the discourse and the discussion we're trying to have. So being white and male, puts me in a certain position in our world. I am a senior citizen, so that could be plus or minus in terms of, yes, I've had experience, but has that experience been useful? I do have an income in the top 10 percentile in the world, so I'm privileged from that perspective, and I've lived mostly in resource-rich countries. And I just like to mention this because it sort of reminds me of who I am and the perspectives that I might be sharing and the limitations and the biases that are intrinsic in some of the things that that are part that make us up. Anyway, basically, this is we don't need to get into, but I wanted to highlight the social determinants of health, examine the impact of militarism, link war, climate crisis, and health, and really explore the individual, the community. Oh my gosh, I'm not sure what happened there. Sorry, my apologies. I think I touched something. Anyway, and to explore the role of the individual, the community, and the institutions, what they can play to mitigate the situation. Now, if we cover all of that in the next hour, it will be absolutely remarkable. So we won't, but we'll touch on it in a way that might be just a little, maybe useful. And please feel free to interrupt at any point in time, because that really this is much more in the nature of a conversation than it will be an absolute lecture. Anyway, now I see Nahid. Nahid, I don't know if I know you, so I just want to find out just a little bit about you, if that's possible, because I know the other members of the audience are physicians, but I'm not sure what your position is. Although we've got Charles as well.
Oh, yes. Okay. Well, I'm a physician in Ottawa.
Okay. Great. Great. Okay.
Mind you, I'll be retiring soon, and
yeah,
very much interested in issues of climate change and yeah.
Okay, so it's just I want to know the audience a little bit, because I don't want to tell you things that you already are well familiar with. But as I've outlined here, there has been a change in how we viewed health over the last 50 years, going from a very medical model, which was really the absence of disease, to a more holistic model where we were looking at the individual in the context of their communities, to really a wellness model, which really Canada was one of the chief architects in its promotion, the notion that health really is a resource by which we can meet our needs, fulfill our aspirations, that it is not necessarily the presence or absence of disease, and that it has a utility as a dynamic rather than a static sort of quantity. But you're all familiar with that kind of thing, which has happened really in the context of our professional lifetime as I look around the table. And it, we all know this model of mind, body, spirit, Mandela. Trevor Hancock pioneered this back in the 80s. But it's the notion that really health is influenced by so many issues. And this has been taken up to understand that health is not in isolation of really the context in which we live and the world in which we live. And the fundamental conditions and resources for health include peace, shelter, education, food, income, a stable ecosystem, sustainable resources, and social justice and equity. That really, without attention being paid to these, it is impossible for an individual to be healthy. And the health of the individual is related to the degree to which these particular prerequisites are available in quality and at times in quantity. And I think, given where we are in the world at the moment, we can see some of the challenges that exist. Anyway, this is all really to do with the Ottawa Charter of 1986. Canada was very much involved in this. And some of the notions were that the action areas we needed to get into as not just as physicians, but really as healthcare promoters, was to build healthy public policy, create supportive environments, strengthen community action, develop personal skills and capacity, and to reorient the healthcare services. So, I mean, and this is really the concerns we have as an organization. Like, what is the healthy public policy in relationship to nuclear weapons and to war? What is the relationship really of that to the environments that it both creates and denies? And what are the community actions that are needed to address the challenges it faces? And what are the personal skills both individuals, physicians, and others need to develop? And of course, well, we won't get into reorienting the healthcare services toward both prevention and the other determinants of health. But anyway, as we are all aware, this has all gone and has gone to a global level with the development of sustainable development goals, which were the previous millennium development, the millennium goals. And this is where the world sets targets in terms of creating an environment in which the health of all is supported. There are 17 of them. The one that I wanted to just focus on, because it is of concern of IPPNW, is peace, justice, and strong institutions. It isn't automatic that people will think of peace, justice, and strong institutions as part of the network that's required for us to be healthy or part of the support system. But I just wanted to highlight that among the many goals that there are, and to point out that really conflict and war is a dire threat to public health. There was a recent Congress in Italy addressing this thing. I just took this poster from it because I felt it underlined that point. But conflict and war currently affects 1.8 billion people. We have seen an uptick in mortality rates, particularly in women and children, in the last 10-15 years related to war. And fully 10% of children on the planet and some 16% of women are either displaced or live dangerously close to conflict. So conflict isn't just, you're in a zone where there's firing bullets. It's the impact that it has in the environment in which you live. The environmental impact is obvious, and so is the impact from a financial point of view. One of the things that isn't thought of in terms of conflict or war is how it limits access to healthcare. In terms of the normal, I mean, there have been outbreaks of infectious disease in many countries in Africa because of the interruption of immunization programs, because of the interruption of sanitation services, and related to war and conflict. The mental health aspect is something which isn't always given the level of attention that it has, but with 100 million displaced persons in the world, and the majority of them being displaced related to conflict, it has a huge mental health implication. So, and particularly for children, because children's both education, the ability of their brains to develop are influenced, their ability of their bodies because of food security, and then that they become prey to more levels of disease because of things like immunization disruption and lack of access to medical services. So this is just gives us a little idea of conflict, and for sure there are less people dying directly from conflict compared to the Second World War. For sure, we've had less. But you can see on this graph that we've had a recent uptick, and we haven't got the information for the last couple of years, but I can almost guarantee you that that will be higher than even that uptick we've had since 2011. So war is not just present, but it's creating, at this point in human history, an increasing level of an increasing toll really on human health and human well-being. Economic costs,
Yes.
this is just a random statistic. USA has spent over $8 trillion on post 9/11 wars. $8 trillion. That's just the US. And most of this money is borrowed. The interest on this debt could exceed, and this is just for the US, could exceed $6.5 trillion by 2025. So it's an enormous amount of resources that are being spent. And currently we're in now really an acceleration of the arms race. And military expenditures in Europe have seen their steepest increase year on year over the last couple of years. And the other point to make is that the three largest spenders, the United States, China, and Russia, account for over half of the military expenditures of the world. So they certainly are at the top of that pile. And yet, as we all know, we are 90 seconds to midnight on the doomsday clock. We know that there is no effective response to a nuclear war, and even a minor one, even a small scale one, like between Pakistan and India, we would have, you know, a nuclear winter, which could potentially, you know, create such mass starvation that, you know, literally 1 to 2 billion people could die just from even a small scale conflict. Okay, the other point now I'm going to get into is really the climate crisis. It's bad enough to have an increasing impact of war on humanity, which we have. I mean, the Ukraine war has just only emphasized that major war, and in fact, whether the Ukraine conflict is the harbinger of a third world war, we really don't know. But whether it is or not, it has had a global impact in everything from shortage of food in Africa to oil prices and heating issues, really all across Europe, and a situation which has now been going on for, you know, much longer than anyone really might have forecasted at the start. Anyway, we're heading into what really is viewed as a Holocene extinction, the sixth great extinction. Global temperatures are going up, and the scientific evidence is unequivocal, and we know that as physicians, as scientists. And this is the IPCC most recent report, which suggests that any further delay in concerted global action will miss the brief and rapidly closing window to secure a livable future. So from a public health point of view, we not alone have war with its implications on human suffering and well-being, but we now have a climate issue which demands global response, a concerted global effort or action. And the point is that the climate crisis, the ecological threats, and the high levels of violence in the world form a vicious cycle. And this is the point really that I wanted to emphasize. And I'm sure, and I know you're aware of it. And these dynamics of the climate crisis and the threats it poses, and the increasing violence from war, they interact with each other. They lead to a degradation of the environment. They lead to a degradation of the capacity of humanity to collaborate. They limit the possibilities of the kind of global concerted action that really are required to address the challenges which the climate crisis poses to humanity. And that really is the point of the linkage between preventing war and the climate crisis, because we cannot plan to kill each other when we need to collaborate in a way that is, and I hate to use the word, it's much hackneyed, but when we need to collaborate in really an unprecedented fashion. So, and just to underscore, the climate crisis is here now. It isn't something which is remote. In fact, I would argue that we are seeing acceleration, that some of the predictions that were in place are now being met with what some people call accelerating events, that the thawing of the tundra and the release of methane may well create an accelerating event. The current situation with forest fires, where up to last week, we have released 5 times the amount of carbon already this year than we will from all the industrial activity that Canada will have in the whole year. We have created 5 times that amount. And given where we still are with the fire still burning, it may exceed, you know what I mean? How many multiples of our carbon emissions will we have produced in Canada, and not just Canada, but in other parts of the world that are not being factored in to the global carbon situation. Just wanted to share this photograph, which was sent to me by Tim, which I think is the West Kelowna fire. I mean, it almost looks, I mean, it's apocalyptic, really, if we think about it. And it's such a huge impact in terms of everything from health to the environment. So anyway, this is Abbotsford and the Fraser Valley. There were 2 atmospheric rivers. So we are feeling the effects of climate change. And the challenge for us is, how do we connect this to our way of thinking? As Einstein said, the unleashed power of the atom has changed everything save our way of thinking, and we drift toward unparalleled disaster. And I think that this really is the challenge for humanity at the moment, is that we have had a mindset where we've approached really the planet with a very utilitarian, almost extraction approach, where we have really mined and exploited the planet for what we needed to create the development we've had, with very little thought of its ultimate impact. And we're now being forced to look at a couple of realities. And I'm not going to go into that because we don't have time. But this really is just the point, that climate crisis, prevention of war, and health of humanity are inextricably linked. And so the concepts that I wanted to share in terms of solutions, and I think we all see them, is the lens of justice. Is it fair that we have a world where we are using enormous resources to really bolster an economic system that has really 20% of the planet is using 80% of the resources of the planet. Is this both just, and from an environmental point of view, is it sustainable? I mean, if the 80% that are using the 20% of the resources get access to even half the resources that the 20% who are using, the 80% are using, the planet doesn't have enough resources. We would reach the limit of the planet's capacity very quickly if we follow the, if we continue with this unjust balance between those who consume and those who don't have the opportunity to meet their day-to-day needs. So that's one issue that needs to be at our forefront. And then probably the most important concept is that of unity, that we are one human family, and that increasingly the solutions that we have to, that will be required, will have to have that as its fundamental thinking. We can't think of ourselves as a bipolar world. We are a multipolar world. We've got to see ourselves as one world, and that we are one really human family, one humanity, the human race is one, and that the solutions that we are going to have to create are going to be ones we're going to have to work together to both develop and implement. And part of the challenge of that unity is the prejudice that exists in the world, and it is seen in many forms, and it's one of the challenges that we have to face is how do we overcome some of the age-old barriers that have prevented us from recognizing our unity. And allied with that is, and this is again where IPPNW and our mission, education is part of the solution. Not just education of the individuals about the linkages between climate crisis, preventing war, and health, but educating ourselves about the true reality of being a human being. That, you know, we need to begin to think exactly what is it that allows us to be the healthiest human being that we can be. And that's a big question, but it's certainly one that's important, because as many have observed, the challenge we face is as much a challenge of the spirit as it is of the physical things that we face. It's going to be how we view ourselves and view others is going to be part of the solution. One of the key elements of that is equality of men and women. We still have a world which is dreadfully divided, and where the ability of women to be able to influence human development is both underappreciated and is really not, women are not allowed the role that they desperately need to have in terms of balancing development as we go forward. I would argue that the kind of prevention of war, part of its solution is that women and the capacities that they bring to the table need to be present at the highest levels in decision-making globally. So, so these bring us to who and how and who, and the protagonists in this whole debate are the individual, the community, and the institutions. And really, a couple of things to mention, and I've mentioned them a little bit, is that going forward, the future needs to be designed. We can't allow events push things the way they've been doing. We now need to get more knowledgeable about the global impacts of whatever particular initiative happens in our world or in our reality. Materialism is flawed, and I'd mentioned that in as much as we have a challenge. I mean, if materialism was going to work, we should have this problem solved, but we don't. And because the gap in resources, as I've mentioned previously, it really traps most of humanity. Most people who would wish to make a difference in their lives really can't, because they don't have access to the resources. So that's a huge issue in terms of justice and going forward in terms of creating a world where we can avoid the conflicts that lead to war and create some of the solutions that will allow us to deal with the climate change. I'm actually going to stop right there, because I think I've kind of gone on a little bit, and I would be interested in both having a little conversation and having a chat about things. So.
Thank you.
I see. Any thoughts, anyone out there?
Barbara's got her hand raised. Barbara, would you like to jump in? I think you're on mute there, Barbara.
Okay. Thank you very much for a very thoughtful presentation. In terms of requiring unity and more cooperation, and due to the fact that the two major problems in the world are as far as the Bulletin of Atomic Scientists is concerned, are nuclear weapons and climate change. I wonder if IPPNWC has been in touch with CAPE to see whether we could work on issues together.
That's a very good question, and indeed, as recently as this morning, I sent an email to Melissa Lem, who is president of CAPE, and she and I are thick as thieves in terms of working together and trying to see how we can collaborate. And in fact, we've reached out to the CMA to see if they will assist us in helping initially work with physicians, because I think that physicians, we have, in my opinion, a professional responsibility to respond to this current situation in some kind of a dynamic way. That if we're going to promote and protect the health of those who we're privileged to serve, we need to both educate ourselves and put ourselves in a role of helping inform policy, plus inform our patients in maybe a new and more dynamic way. So those are some of the things we're exploring, Barbara. But you're absolutely right. This is something which I think collaboration is key to us going forward with this.
The other climate group that might be very helpful to collaborate with, I think, would be the Ontario Clean Air Alliance. Angela Bischoff is a very, it's a very dynamic group. So
yes, and I think that the disarmament movement, are going to have to look at, how they're going to position themselves in terms of helping educate people as well, because I think that when we go nowadays and say, look, we're worried about nuclear weapons, it's very, you know what I mean? We're not getting the response that we would have gotten 40 years ago. It's a different world, and how people react to, you know, being told about the nuclear threat on its own is different to the 1980s.
Could I just push you on that one? Am I unmuted?
Yes.
In what way is the reaction different now? I'm asking the question because I think that, you know, you've given a great sort of engineer's approach of the problem and how it all fits together. But we need mechanics everywhere to try and do the work necessary to divert the threats that confront us. And one of the things that appears to me to be remarkable is the fact that whilst 70% of Canadians some months ago expressed their opinion in favor of the Treaty for Prevention of Nuclear Weapons, the government did nothing, and there is no widespread movement for change. And I think it's psychological, sociological problem that people feel helpless and overwhelmed, and there's nothing. We're not a nuclear power in Canada. What can we do? Well, we can start off by using our power within NATO to change NATO policies. No first use, obviously, being first priority. Why? I guess what I'm asking is, encouraging more discussion of, is what can we do to overcome the apparent readiness to just accept the problem and leave it alone, wait for our fate?
That's a very good question, and observation. My feeling is that the global nature of the problem is something that has to be highlighted, and the paralysis of the United Nations, particularly through the Security Council, to actually provide peace and security is going to have to be addressed. When the Ukraine conflict is over, and please God, it will be sooner rather than later, but it will be at some point, the post-Ukraine conflict world is either going to be one which will be a Cold War, which will be worse than the one we've had prior to the dissolution of the USSR, or there will be some kind of a groundswell to say, this can't happen again. You know, a nuclear weapon states can behave really with flagrant disregard of any international norms. You know what I mean? That has been shown, that the nuclear deterrence, which, you know, has been the mantra of, you know, the nuclear weapon states, and particularly our American friends, that has to be challenged. And I think Canada has a role in helping our US neighbors understand that, you know, that's not any longer, you know, a tenable approach. And, you know, there's this geopolitical bipolar kind of thing which is happening, but there's also a multipolar approach, which somewhere we have to reform the United Nations. I mean, we will not get nuclear disarmament until the P5 no longer have a veto. That's probably, at least that's how some see it, is that really creates a situation where the investment these countries and they're being invested in nuclear weapons is really standing four square in the way of progress, because we will not really prevent war unless we get disarmament. Nuclear disarmament has to be one of the first steps, and I don't believe we will get that when we have the P5 with the veto, or at least there has to be a mechanism to allow the will of the rest of the world be exercised in terms of the peace and security of humanity.
Well, I think we have to get the P5 to change, and it won't be an easy task, and it's not going to be a quick task, but it needs to be led by a demand which is so compelling that these countries decide that they can modify their policies, because otherwise, the outlook is indeed grim. I don't know how many people have seen the Oppenheimer movie, which I think is a great opportunity to work at whatever strategies we think are most effective in getting people to confront the nuclear threat. But it amazed me that a reviewer recently did a piece commenting on it rather than actually reviewing the movie. The pungent last sentence in a short final paragraph was, "I left the theater feeling that I had lost my sense of time." Well, it was a long movie.
Right. Right. Yes.
Partly responsible. But if that was all that he got from the movie, well, it wasn't. I mean, there were other points, obviously. But I was so flattened by that level of comment. That was how he walked away from his article, by saying that his sense of time had been affected. Well, poor guy. Let's move on to somebody who's worried about some of the real threats.
Right, and to be quite honest, I really do think that one of the challenges that we face is that we actually need more individual and community engagement in the problems that face communities. Because I think that what will help us is when we get more people who are wanting to make their world a better place. And the climate crisis is so huge, and the nuclear threat is so awful, that we often don't almost want to think about that. And we need to break it down to what can you actually do in your environment day to day that will make the world a better place, and connect that and help then connect that to the global picture. You know, the notion of act locally, think globally. And because like, for example, this is my bias, in Canada, if we don't solve, for example, the housing crisis or the drug, you know what I mean, the toxic drug supply crisis, in a country like Canada, there's very little, it's poor lookout for the climate crisis globally. If with the capacities that we have, that we can't have more ability to deal with the issues we face. And I think that that's part of where we are in the world, that in some ways, we're not as committed to making the world a better place as we need to be. We are distracted by so many elements that, don't allow us fulfill really what may be our true human nature, which, as we know from a mental health point of view, is serving other people, is so useful. It's such an antidote to anxiety, depression, and all of the things that we see, that to me it's intertwined. So, and when I say it's as much a disease as sorry, not a disease, but a challenge of the spirit, that's really partly what I mean, because the world is going to have to change. That's obvious. You know what I mean? We have to change the way we do things. Exactly how we do that, that's up to us. But I think that we have to see that we can't all point fingers at people at a global level to say they're the ones who've got to change. Because I do think that the future of really development is a local issue, obviously connected to the national and the regional and the global, but more involvement in making the world a better place next door and with your neighbor and in your neighborhood, I think is a key piece of how we go forward with this.
Don, do you mind if I ask a question?
Sure.
I really agree with I really like your point on community engagement as a necessity for moving for a solution of these issues in Canada. I think a lot of Canadians this summer specifically, as a lot of people were talking about before the meeting started, Canadians are feeling the firsthand impact of climate change, and with in Kelowna right now, with people evacuating their houses, but also Ontario, Montreal, across the country, and Nova Scotia with the floods. But the immediate impact of conflict and nuclear weapons are not as palpable, even though Canada as a country contributes to them. And in your presentation, you outlined all of the linkages between them. But how do you think that we as an organization or as individuals in our activism can effectively establish those connections between the abstract and the problems we see, whether it's on a community level with housing crisis and the transfer of money, how much goes towards military and housing crisis, or whether it's climate change and war? How do we effectively establish those connections and make conflict, which we as Canadians are very privileged not to face, despite our country contributing to them, and climate change, and how do we make it more evident and meaningful to Canadians?
I think that's an excellent question, and I think that one of the issues we have, our tool is education, and how we link the issues, because knowledge really is recognizing the links between things. And if we are going to, and this is, from a human health model point of view, when you go back to the psychosocial model and the community model of health, the stronger the community is and the more mutual aid assistance that exists in communities, and the more just the community is. I mean, levels of health are higher in communities where the disparity between the richest and the poor is not as high. And I mean, we've got examples of that worldwide, and we've known that for years. We've got to educate ourselves about these disparities, because if we don't look at this issue through the lens of justice, we're not going to solve it. And humanity has not, to this point, used justice as the arbiter of development. We've used economics, we've used power, we've used oppression, but we haven't used justice. And so that is a huge reorientation of our mindset. You know what I mean? I mean, we have got to realize, yes, the climate crisis is there, but it really is a symptom of humanity's, and particularly some elements of humanity's, willingness and determination to exploit the situation for economic benefit. And to some extent, economic benefit is still a huge driver in our world. And we've got to understand that there are other things that make a nation wealthy, that make a society useful, that isn't their GDP. But how many kids go to school with a full belly? These are some of the metrics that we need to somehow put as being important, because if we put these metrics as being important, then we will bump into the challenges of why are we planning to kill each other? You know what I mean? If you begin to create a world where you're beginning to say that we all have an interest and a purpose in the well-being of others, because that really is fundamental to this whole issue. We have to begin to see that. And that is something that an individual, I can't tell an individual what they should do. They've got to think this through. Do you know what I mean? And begin to understand that it is our way of thinking is the problem. But the other part of the solution is that we have tremendous capacities as human beings, tremendous. We are resilient, we are, innovative, we are thoughtful, we are caring, we are compassionate, we have got all kinds of capacity to make a difference in our world. And that is the currency we have to spend. The currency we have to spend really is the currency of love. If we don't really love each other and love humanity, we're in trouble. We're in trouble. And so when you're asking, like, what do people do? That's the message that I think we have to share from an educational point of view, and that we have to, as we go and do our actions, whatever they might be, they're consistent. There's a coherence between our view of the world and helping others and what we do. If there's a coherence between the principles we espouse and the actions we undertake, we're in great shape. The challenge for humanity is we have a set of principles, we have the Universal Declaration of Human Rights, and we ignore it. We ignore it in so many instances and in so many places, that we have to have a world based on principle and not on profit. This is a shift that we have to think in. I mean, I put in one of the topics, you see it there, religion is both a problem and it's a solution, right? It's, there's elements which we can take from religion, which are really important in terms of how we should treat each other and how we should treat the planet. You know what I mean? I mean, for example, the First Nations worldview of how nature should be honored and respected is key to us going forward in a way that we can begin to treat the planet in the way it should be. So those are some of the thorny issues, but I think as we begin to discuss them and begin to understand them in a non-threatening, non-partisan way, you know what I mean? Saying, I know what's right, the waggle of the finger, that's not the way. The process by which we, involve and get engaged in these issues is actually as important as their content. Barbara.
I don't want to take too much time, but it seems to me that one of the major problems with changing attitudes is fear. Fear of change, fear of losing your job, fear of other people's that we don't know about, and so forth. And therefore we think we have to have nuclear weapons or we're going to be conquered, or we think we can't change to non-carbon forms of energy. So I think that tackling fear and saying, yeah, you're quite right to be afraid, but if we use nuclear weapons as a counter to that fear, we're just creating worse fears. And the same thing with, clinging to wrong forms of energy. But so when we say we understand, but then we I think we have to give people hope that there are other solutions, and that they can help work with them. So that you know, and let them know that they have ideas that they can contribute. They don't just have to listen to those of us who are preaching. You know, I'm a great fan of the 3H thing, the horror, humor, and hope. And so I think we need those.
Absolutely, Barbara. You're right, because I mean, we've had a tradition in the world of tribalism, and I mean, we do have this reptilian brain. You know what I mean? Which divides the world up into the in-group and the out-group. Do you know what I mean? And the out-group we can't trust, and the in-group, well, you know, that's all well and good. And that has been part of human history forever. And now the fear is that if, you know, we do change, do you know what I mean? That what my group did to somebody else, that group is going to do it to me. So therefore, I can't take that risk. But the point being is that regardless of in-group or out-group, if we don't get along together, the whole planet, you know what I mean? It's going to be a mess for everybody. So we're caught. So maybe we need this existential, really, driver to get us to get into that new psychological mechanism whereby we can begin to see ourselves as really one human family with a common homeland, with you know what I mean, with the same needs, regardless of where we are. And as physicians, we know people's needs are all the same. You know, it doesn't really matter where you're from. You know, your blood is red. You know, your hemoglobin does the same job. and that, I think, is something that we can offer as physicians as well. That this is our experience in the world, and that we, you know, can help with the process of change that's going to be required. It's a big ask. It's a big ask. It's a big ask because we haven't done this before, you know, and we've invested a lot of human ingenuity and resources in creating a world where the divisions are nailed to the wall. You know what I mean? Where we have created, you know, divisions which have justified everything from genocide to prejudice. Yeah, I'll just finish off. If you read that slide, okay? And I think this is important as well. Everyone wants meaningful work. Everybody wants to make a difference, I think. They want to feel that they're contributing to their own well-being. They feel better when they're contributing to well-being of others. I mean, there are exceptions, but that is so cross-cultural and so global. Equality of women and men is central to global development. I think that's a given. And it's something we have a huge amount of work to do on. And so, I mean, if you're asking what concrete things people can do, there's so much to be done in that sphere. Reform of global institutions and governance. David mentioned that, and I think that more and more attention needs to be brought to that. And power is no longer wielded as an advantage over others. That is something which is a huge issue for us in the world at the moment. How do we use power? And when we do have power, and there are countries and nations, and we're one of them, who have power, but how do we use it? And then authority is governed by principles consistent with the needs of humanity, not with the needs of an economic model that you know, is time worn and needs review in terms of its purpose and its benefit to humanity. Anyway, I've lots more slides and I could go on all night, I'm sure, you know, but you know, any other thoughts before we maybe should head for supper or wherever? Maybe supper isn't, maybe people have had supper, but I haven't. I see Jan Christelaw is there. Hi, Jan.
Hi, John.
How are you doing there?
Good, good. I'm in Northern Ontario tonight.
Oh, okay. So you've had your supper.
I've had my supper. Yeah, but it was, thanks very much for the presentation. I got in a little late because I was coming in from the bush. So, but
That's
it was
okay.
great. It's very thought provoking, and I think about these things all the time. I mean, this is essentially the two great issues that we have to face every day, and we cannot abandon one for the other. We have to be seen as being consistently involved in both of them. I absolutely agree with you.
Yes, 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 indeed, indeed. Well, look, if any other comments or questions or, you know, before we close. Well, I'd like to thank you all for being here. A select group, a motley crew, and it's really nice to have had the opportunity to share these ideas with you, and let's see where they bring us. Oh, Marnie.
I just wanted to emphasize my gratitude for your words tonight, John. It was very, very, very comforting, inspiring, and all of those things, even though it's like profoundly troubling issue. It was very inspiring what I heard from you. Thank you deeply.
Oh, you are so welcome, and thank you, Marnie. So with that, if there isn't anything else, I'll bid you all a good night, and thank you so much, every one of you, for being you and being engaged in this, because as a physician, I can't think of a more important thing that we could be doing, and as a healthcare, you know, professional, this is our job. All righty.